Hi, I'm Dr. Alex Khadavi. I'm board certified dermatologist. And for facial rejuvenation, we generally in my offices and in other physician offices that provide microneedling or other techniques, they do it along with use of RejuveMD. And the reason we use the RejuveMD is anti-aging treatment that I helped develop that have growth factors that help stimulate the collagen production or help rejuvenate the foundation underneath the skin to help with the fine lines, wrinkles, and help make the skin more rejuvenated in the sense of stimulating the stem cells. When you're stimulating stem cells, you're reactivating the skin, making it more youthful, but also you help with scars, help reduce pore size because you are producing the important components underneath the skin. Now, when we're speaking about microneedling for scars, this goes by the similar principles. We are stimulating collagen production, we are stimulating the stem cells, and we are going to be reducing pore sizes, we're going to be reducing the scars, the depth of the scars, the width of the scars, and the length of the scars. Now, when we speak about hair rejuvenation, we also talk about using microneedling, but use of it with Revivogen, and Revivogen is the formula that I helped develop that addresses the root cause of hair loss. It reduces the bad hormones that come on the scalp, and when you're reducing the bad hormones, which is specifically DHT, you're allowing the hair to grow in the right environment so it could go longer and thicker, reversing the what we call miniaturization process, where the nice thick hairs become finer, thinner hairs. And again, we use that along with the microneedling, and depends on the patient, but generally we do about 3 to 6 treatments for each of these purposes within the 3 to 6 months period of time. Next slide. Now, I was one of the first doctors to really use microneedling a lot in my practice. We began to use the roller. I started using the roller over 13 years ago. And the roller was great in that it served the effect of rejuvenating, as I said, or stimulating the stem cells underneath the skin, stimulating collagen production, elastin, helping rejuvenate not only the face and the skin and help with the scars, but I found also, over 10 years ago that it helps stimulate hair growth. We moved on into using the microneedling pen. And I use Eclipse in my office, where the pen has a ability to perpendicularly go into the skin without causing the trauma of lateral insertions of the needle into the skin by using the roller. It is less trauma into the skin. However, it still serves the purpose of rejuvenating the skin by stimulating the stem cells and stimulating the important components, as we said before, collagen, elastin, and glucosaminoglycans. And you can see that it is a easy technique. When I'm going to show it to you, it could be done by nurses, it could be done by physician assistants, by nurse practitioners, and of course, physicians, MDs, and Dr. Osteopathics. Next. Now, when we use the microneedling, and specifically for rejuvenation, rejuvenation really gets stimulated by use of growth factors, and not just peptides. Real growth factors with the entire sequence could be anywhere from 80 to 100 to 200 amino acids in length, and the ones that are found to be most important in rejuvenation of the skin, in anti-aging, and scars include the epidermal growth factor, fibroblast growth factor, and transferrin growth factor beta. These are the most powerful stimulators of growth of the skin and rejuvenation of the skin, and have not only been shown to help with fine lines and wrinkles, but really give lifting and tightening of the skin. We also find that these are very effective for scarring within the skin, whether it's acne scarring or other types of scarring that happen within the skin. Not so much pigmentation, but the depth of the scar, the length of the scar, the overall redness of the scar, and being a more conducive and elevation for the skin. Now, also we find that when we're using these growth factors, sometimes in our office we find that they also help stimulate the hair. However, we have not done studies to show how epidermal growth factor or fibroblast transforming growth factor clinically are affecting the skin. We have evidence in the laboratory that these growth factors not only help stimulate the collagen, elastin, glucosaminoglycans, but can somehow stimulate the stem cells for the hair follicle and make the hair follicle longer and thicker, and sometimes bring back the hair shafts that are resting, basically bringing back some of the hairs that were not apparent before, really regrowing the hair. Next slide. Next slide. And speaking about these growth factors, I began to formulate an anti-aging treatment called Rejuve over 10 years ago. Now, I had a lot of patients come into my office requesting anti-aging treatments, and that time things that were available were the retinoids, vitamin C's, they were use of lasers or chemical peels, but nothing was directed right at anti-aging. Well, I understood that anti-aging process requires a rejuvenation or bringing back these growth factors that we talked about that are getting decreased in production as we age. So I found a way of bringing back these growth factors and delivering into the skin, not just placing on top of the skin, but actually help deliver them into the skin with the use of what we call liposomes. And liposomes are basically packages of these active ingredients, and these active ingredients are helped get absorbed within the skin. Other products that are advertised as having growth factors really either don't have the right quantity of these growth factors, or they don't have the right quantity. They have very, very small numbers. These are primarily used for marketing, or they don't have the entire sequence. They may have a very small 10 or 20 amino acid length, not the entire 100 or 150 length of the amino acids that are really the size of these growth factors. And most importantly, they don't have the delivery mechanism delivering these growth factors into the skin. And the product is RejuveMD. We also have the RejuveMD face and eye. The face is used on the face, is used on the neck, it's used on the chest area. And again, liposomally delivering these active ingredients into the skin. And we find that these products work extremely fast because they are targeted right at the anti-aging process. Now, we can see here for the eye formula, which is slightly different from the face. It has the growth factors, but it also has anti-inflammatory ingredients in there, plus other ingredients like Richard Broom extract, which helps with puffiness and dark circles underneath the eye. You can see only after 28 days, not only effect on the fine lines and wrinkles and some of the puffiness around the eyes, but you see that how the skin and inflammation around the eye has improved. These growth factors are very powerful in that they're able to rejuvenate skin in multiple aspects, not just in anti-aging, but also as anti-inflammatory. You can see the real power here of Rejuve Face after 28 days and 57 days. It just doesn't help on the fine lines and wrinkles. You can see on this patient, her face is actually lifted. And when we're looking at a patient, the sagginess of the skin or the the drooping of the skin really shows someone subconsciously how old they are. It's not just a number of lines and wrinkles that they see, but if you're able to not only reverse fine lines and wrinkles, but give that lifted effect on the face, you're really creating an anti-aging effect. And we can see in a very short time, after 57 days, this patient looks much younger, much more youthful. And we also want to speak about Clearogen. Again, I spoke about my anti-DHT acne treatment and anti-DHT. Just to review, DHT is a hormone that causes hair loss and causes acne. If we are able to reduce the DHT, we're going at the root cause of acne, and we're able to not only stop the acne from happening, but your skin doesn't become habituated to all the other products that are available for acne, like benzoyl peroxide, salicylic acid, and other antibiotics that are available, whether prescription or non-prescription. This product continues to work, unlike other products that patients are prescribed or given to, at the drugstores, because it goes to the root cause of acne, and there's no other acne treatment out there available that does that. In addition, because it is formulated with very gentle formulation, continuous delivery, it does not cause irritation. Very low chance of irritation, less than 1%. Your patients are going to be extremely happy with it. And in fact, patients who have redness, irritation, or even have rosacea could use this. They primarily have them use the sulfur formula, and in fact, it helps not just for acne, but it helps for rosacea or sensitive skin. And we could see, go back, it's shown to clear about 74% of acne in 4 weeks. Not 74% of patients responded, over 90% of patients responded, but they were able to clear their acne by 74% in the lowest 4 weeks. And that goes to the power of going to the root cause of the acne, not just treating the existing acne, but preventing the acne from coming into the skin. Next slide. And again, it's made to be safe for both men and women. It reduces the bad hormones that come up on the skin, so it's not going to have any systemic effects, not going to have any hormonal effects to the body. We could see how effective this product really is. We could see that this patient on top has severe cystic acne, and only by using Clearogen within a 4-week period of time, not only his mild papules and pustules were clearing, but also his cysts were clearing. And some of the redness over here is just post-inflammatory pigmentation or some pigmentation that's left over there, but majority of the acne on this patient is clearing in as little as 4 weeks. And we could see the patient on the lower side, this is an Asian patient. A lot of Asian or dark-skinned individuals have they develop pigmentation after their acne. Not only did her acne cleared up, which is a hormonal acne, which happens in the cheeks and the jawline and around the mouth, but also her scarring improved. We don't have studies on this. However, we see that if you just use Clearogen by itself, you not only help with the acne, but patients have improvement in post-inflammatory pigmentation and some of their scarring. And if you specifically combine it with microneedling, you're going to get even more improved results in the acne and in the scarring effects. And again, other patients, just by using the Clearogen, you can see a teenager with diffuse acne all over the face, and the lower patient was, again, a female with acne that happens within the jawline around the mouth, primarily due to the hormones. Women around their menstrual cycle, they develop more acne. This again addresses the root cause of the acne for females, whether they're teenage or adults, 30s, 40s, and 50s, when their hormones change in the body. Clearogen is going to be able to work for them. Now we could see for the MicroPen, Eclipse MicroPen needling, this is a patient for before and after scarring. You can see just in 1 month improvement of not just the scars, pigmentation within the scars, but you see the reduction in the pore size. It works quickly within a month period, but even if this patient did not have any subsequent treatments, they will continue to see improvement of their scars for 2, 3, even up to 6 to 9 months afterwards, just with one treatment. We typically have the patients do one treatment every month for at least 3 treatments. Sometimes we go all the way up into 6 treatments. And after that, sometimes they love the treatment so much, the way that it makes their skin feel, that we continue to have 1, 2, or 3 treatments per year repeatedly to help rejuvenate the skin and help maintain the skin from developing scars or as anti-aging. You can see also this patient, they just had the microneedling 1 month after their treatments, 1 month after their 6 treatments, and these are 1 month intervals. You see the dramatic improvement of her scars, the pigmentation within the skin, and there's actually more plumping and tightening of the skin for this patient. Next slide. Now we talk about use of Revivogen, which is the hair loss treatment that I helped develop, and this is the research behind this is from over 20 years ago, where I discovered that hair loss could be stopped not only by use of anti-hormonals orally, but also topically. And specifically, treatments that are reversing the hormone that causes hair loss, which is DHT. We talked about DHT, dihydrotestosterone, as the primary cause for acne. Also, DHT is the cause for hair loss. We use topical free fatty acids, beta-sitosterol, and ethyl laurate, also prostaglandin, which is grapeseed extract. All of these help to reduce DHT, reduce inflammation, and help stimulate the hair into the growth phase. And we combine this with the microneedling, and the patients get much more dramatic improvement within their hair loss when they are combined together, because one form is helping stimulating the hair follicle with the microneedling, and Revivogen helps reduce the bad hormones that come up on the skin, specifically DHT, so that the hair could grow in an environment, it could grow longer and thicker. It has a 88% success rate. It is very successful within physicians' offices. It is, in the US, the #1 natural treatment for hair loss recommended by physicians, whether they sell it in their offices or they recommend it to their patients. And we are currently in 35 countries around the world selling the product, primarily recommended by physicians. It's not just put in drugstores. It's really recommended by the authorities in hair loss, whether they're hair transplant doctors or dermatologists, there's OBGYNs, or other experts in hair loss, really that know and understand the science of the product, have used it and had very high success with it. In fact, we have independent studies, not just in the US, but in Korea and also in Russia, proving that the product works. Next. And there's no minoxidil in the product, so you're not getting minoxidil, you're not getting finasteride, propecia. It's all natural. It specifically goes into the scalp, doesn't go throughout the body, gives a local effect. We see the benefits for these patients. They typically get 1 or 2 Norwood scale improvement. Patients are generally happy maintaining their hair, but they're ecstatic when they're able to actually reverse the hair loss. This is after 9 months, what first said, this is after 12 months, and the patients, these patients are between the ages of 30 and 40. Primarily, age does not matter. Our study was done on patients between 18 and 55. We don't have a lot of data of patients over 55. Anecdotally, we see that patients that do use the product report to us that do very well with it, but we cannot guarantee 88% of the patients are going to have either stopping the hair loss or regrowing the hair. And again, we can see the improvement of the density within the scalp. Generally, what you're doing is you're taking the finer, thinner hairs and you're making them longer, you're making them thicker, basically increasing the density within the scalp, increasing the length, diameter, width of the hair, so it makes the hair look thicker. And these are on female patients. We can see for females, the first sign is not so much of a bald patch or a regression of the hairline, but you could see the part of the hair becoming more apparent, more of the scalp starts to show when they use Revivogen over a 12-month period of time, and on the second one over a 6-month period of time. They're getting thickening of these hair follicles, again reversing the miniaturization process, making the hairs longer, thicker, improving the density within the scalp. And this again, it could be used with other modalities, not just microneedling. It could be used with the laser treatments that are in home or in the office. They could also be combined with PRP. A lot of patients undergo hair transplant. They could combine it with the hair transplant because the hairs that are already existing on top of the scalp still need to be protected against DHT so the hair could grow longer and thicker. Next slide. Now this is a hair restoration before and after use of the Eclipse MicroPen and the PRP. You can see a very dramatic improvement of this patient 60 days post just one treatment. This is probably one of the best results that I see. I primarily do microneedling. I'm not doing as much of the PRP because I see when the microneedling is done in regular intervals, the patient comes regularly, they're getting almost as good or if not better improvement as compared to PRP, and it's less expensive to the patient and they're more likely to continue doing the treatments. And they're happy to combine the treatments and go home with either Rejuve for the anti-aging, using Clearogen for their acne, or using Revivogen scalp therapy to reverse their hair loss. Next slide. And we can see on this patient, you see improvement in the density within the hairs, primarily within the frontal area, the areas in the Willow's Peak. are not so much improved. I don't have a more closer look at the scalp, but areas where the hair is where the scalp is shiny, there's no hairs, there's no miniaturized hairs, there's no peach fuzz hairs, the hair is generally not going to grow in those areas. Next slide. So we're going to move on into showing how we do the microneedling technique on the face and on the scalp, and we'll answer any questions. I'll go directly to the actual procedure. We're going to be using the MicroPen. Okay, so we have our patient here, and he was complaining about some of his acne, and some of his acne. We've improved his acne by using Clearogen. Now he wants to work more on scars. He only has a few wrinkles, right? Right. What are you complaining about? Just kidding. But you know, there's always rejuvenation of the skin. It's never too late to start working for anti-aging of the skin. We like to, start anti-aging of the skin before it even happens. Some people say that aging could happen anywhere from the age of 18 all the way up into 25, depending on genetics. If you're lighter skin, your aging process is going to happen quicker. And generally, before we start putting the MicroPen on, we put the Rejuve gel on. Rejuve gel/serum has hyaluronic acid in it, so not only helps on gliding the MicroPen, but the hyaluronic acid, the low-weight molecular hyaluronic acid, has an anti-inflammatory effect, so the patient could recover from the treatment faster. And when you're using the Rejuve gel, both in the office while doing it, you improve the absorption of it, and when they're using it at home, particularly for the first week. And then afterwards, they can use the Rejuve for their acne scars and rejuvenation of the skin. Okay, so we have the pen over here, and we have the needles are, I don't know if it's hard to see over here, but we have multiple needles at the edge. The great thing about Eclipse is it does not have a cord on it. The battery is charged. It comes with two batteries. One could be charged while the other one's being in use. You put a sterile, or not necessarily sterile, but it has a sterile sleeve that's you use a clean technique for. And we turn it on. Generally, I start for the face for rejuvenation at a length of 1. Patient could generally tolerate that. After being on topical anesthetic, typically we use the tub anesthetic, lidocaine, bupivacaine, and tetracaine. You put it on an hour before and also half an hour before. And we'll start demonstrating over here. Generally glide the pen across. Now the classic technique is to go, passes and go back. I sometimes in a rush when I'm doing it myself, sometimes I go just back and forth over here.
How are you feeling?
How you doing?
I don't even feel it.
You don't feel it, yeah?
Nothing.
So at this length, sometimes you don't get any bleeding. Sometimes you want to go a deeper than that. So straight down, put it across, and we adjust it. It's a brand new pen, so I have to technically work on it a little bit here. So it's good to test your equipment before you start. Okay. So a little bit more. Make a little adjustment. It's a brand new pen, so make sure I adjust it right. Tolerable, not that much pain, right?
No.
So we're about 1 millimeter depth. See the increased redness that happens. Again, most people glide it across and come back and forth. I generally go back and forth, getting similar kind of effect because you're going perpendicular. You're not really damaging the skin. You're still getting the anti-inflammatory effect as the Rejuve gets sunk into the skin. You doing okay?
Yeah.
Okay, so we could stop and go slightly deeper over here so you get more effect of the... A lot of times I go with feel of the patient to see how they could tolerate it. If they could tolerate more, I try to go more, just explain to them that there's more chance of them that they could become bruised. The bruising that happens is usually very superficial, typically goes away in 2 to 3 days. Okay. A little more painful, right?
Oh yeah.
So we're going 1.5. So you see when we go 1.5 now we're getting a little bit of bleeding. That's because we go into the papillary dermis. And this length is great because it works wonderfully for the, not just the anti-aging effects, the scarring, the pitting of the skin, helps reduce the pore size. And we do a lot of passes within the office. When I was giving my presentation, I said sometimes we do 10, 20, or 25 passes. Well, if the patient is numb right with triple numbing, or some patients we even give them like a little bit of Xanax for them to relax before they come into the office. They do extremely well. How you doing here?
Good.
Not that bad?
No, it's not bad.
So, he's doing a great job. He's tolerating very, very well. You can see, we could get a lot of passes in here, really cover those areas. And, the more passes you do get more added benefit, not just for the scarring, but the anti-aging effect. And, you want to address the whole face, all the way back, all the way in front of the ear. Not only helping within the scarring effect, but also try to pull the skin from every direction possible. And you can even do circular motions, within the skin. It doesn't really matter. You're doing the needles go perpendicular within the skin, so it does not matter too much. We just for demonstration, we're going to go into the other side, and then we go into the forehead. The forehead, because the skin is thinner, it hurts a little more, so we're not going to go as deep. Typically, maximum I go is about 1. On the neck, you could go 1, 1.5. Again, we typically do it as long as the patient could handle it. If you go down to 2, you have to warn the patient that they could get bruised up to a whole week. Generally 1.5, you could get bruised to 1 to 2, maybe 3 days. Now, because we do a lot of passes, and a lot of the people at my presentation were surprised that I told them my patients get peeling effect, and you're naturally damaging the stratum corneum, and after 2 or 3 days, because again we do so many passes, the patient does typically peel from the treatment, which is not a bad thing. We're rejuvenating the skin. This bit of trauma that occurs again helps activate the stem cells sitting at the bulge of the hair follicle, both stem cells for skin rejuvenation and for the hair follicle, but also help the fibroblasts, the senescent fibroblasts, the fibroblasts that are sleeping, that produce the collagen, elastin, glucose, and the body can't wake up. So you can see it's not so much exact technique of lateral movement. You could do this if you choose to do it, but making sure you're perpendicular into the skin, and you could go back and forth, or you could go in a circular movements. You doing okay?
Mm-hmm.
He's tolerant very well. You know, 1.5. A lot of patients again don't tolerate 1.5 very well, especially the guys. So he's doing pretty good here.
His skin's gonna look great.
Yeah, you know, the skin. You know, patients are generally very happy. You know, with this treatment. The first time, sometimes they say that they have pain. The second time, they don't care. You know how much pain, because they notice how good their skin becomes after the first treatment. And you can always go back and some more, make sure that the amount of gel is enough over there. Okay. How you doing? Doing okay?
Yeah.
Okay. So that's a demonstration on the face. We'll answer some questions in a few minutes. We're going to start doing the demonstrations for the hair. Let's see if anybody has any questions before we start doing the scalp. Where's the type questions?
Let's see the questions.
Good time to ask questions. Anybody?
Let's see. There you go.
What was the question? Can you hear?
Do you clear up the acne first before using Clearogen and microneedling together?
Okay, the question is do we clear up the acne first before we do the microneedling along with the Clearogen? We start both of them at the same time. If a patient is anxious to get their, and not only getting their acne better, but their scars better, we get them on the Clearogen system right away, and they could start the microneedling that day or the next day. Generally, we don't have them use the Clearogen lotion. There's a 3-step treatment. There's a cleanser, toner, and lotion. We don't have them use the lotion or the toner the first 2 days after the treatment. After that time, they can use the whole Clearogen set. So we like to do it in combination. We want to reduce the DHT, we want to help with the acne, and we want to reverse the scars altogether. You do not have to wait.
And this one is, will stretch marks respond to microneedling?
So the question is will stretch marks respond to microneedling? Microneedling is one of the only treatments that I have seen that works for stretch marks. And when a stretch mark is more fresh, more red, more, at the earliest stages, the microneedling works the best. And we generally combine the microneedling with use of Rejuve. The growth factors in Rejuve help stimulate the collagen production underneath the stretch mark, bringing back the skin, thickening it, and making the stretch mark less noticeable. Now, after doing 6 of these treatments, sometimes patients are getting up to 50% improvement. And sometimes after they get that maximum improvement, we even do cosmetic tattooing within the stretch mark, making the skin more even or less contrast with the normal skin. Next question.
Next question is, how do we know that RejuveMD does not increase risk of skin cancer?
Okay, so great question is, how do we know that RejuveMD doesn't increase the risk of skin cancer? Well, we're using transferrin growth factor, epidermal growth factor, and fibroblast growth factor. And these can be increased, produced underneath the skin without producing cancer. Now, we're not increasing the levels above what we're meant to. We're bringing back the levels to what the skin was under conditions when we were age of maybe 15 or 20 or 25. Technically, it's very difficult to get much higher concentrations of these growth factors within the skin, even though that we have high quantity of it within Rejuve, even though we have human light, we have the exact sequence of there, and even when we have liposomal, we're not able to increase the level to high enough for it to cause cancer. We're basically bringing back to the level where the body was, or the skin was at the age of between 15 and 25. We're going to demonstrate how Revivogen and microneedling work. Again, Revivogen's anti-DHT treatment reduces the effect of hormones on the scalp. Again, hormones, in particular DHT or dihydrotestosterone, cause gradual thinning of the hair. Thinning could happen within the crown of the scalp, could happen within the front of the scalp for the males. For the females, it could involve diffusely over the entire top of the scalp. Now, we use Revivogen. Revivogen works for patients who have both early and late-stage hair loss. Unless their head or scalp is completely bald, Revivogen is going to work for them. And if we use it along with microneedling, and again, similar technique, we use it for rejuvenation of the skin, for acne scars, and for lifting and tightening, being that we do 1 month intervals, we do 3 to 6 treatments, we're able to help stimulate these hair follicles, make them longer and thicker. And similar technique, I use a sterile microneedle, place it on, using the Eclipse microneedle device on here.
You said you just have to wiggle it on.
Okay, this one's brand new, so gotta wiggle a little bit more.
And this is Eric. Hi, Eric.
Hello, everybody.
Are you excited for your microneedling treatment?
Sure am.
Okay. Where's that?
Now, do you put RejuveMD on the scalp as well?
You always want to be able to glide the MicroPen, whether you're putting it on the skin or you're putting it on the scalp, with a form of hyaluronic acid. And again, Rejuve has low molecular weight hyaluronic acid, so it allows for the microneedle to glide on within the scalp, but it has the growth factors to help stimulate the hair follicles. Even though these growth factors are primarily for anti-aging, we find that they're able to stimulate the scalp and to help stimulate the hair. Again, we use low molecular weight hyaluronic acid, which is anti-inflammatory. So you're gonna feel like a little tingling within your scalp here. Doing okay?
Mm-hmm.
Doing a little bit of needling in there.
Yep.
Not too bad.
Not at all.
Okay, and again, you can go multiple ways. We typically try to part the hair. Some of the areas are more easily accessible. Sometimes if you don't part the hair could get stuck or pulled into the device.
That's okay. Technical difficulties, but we'll fix it.
Okay, now you want to bring it up higher so you can show. You want to bring it up a little bit higher, Jennifer?
Yeah. Just one sec.
Okay, so that was at 0.5. We're going to go a little bit deeper on here. Not too bad, right, Eric?
No, it's fine.
Okay, I'm going to go. Feel a little bit more.
Yep.
Go a little bit deeper here. Generally within the scalp, we go about 1 to 1.5. You get slight bit of bleeding. You don't get as much bleeding on the scalp as you do within the face. And a lot of people were surprised how many passes we do. Some we do 20, 30 passes. And you can see a little bit minute amount of bleeding coming through. Are you tolerating? You feeling little needles there?
Okay.
Again, most people are, because they know the benefits of it, or especially their second or third time, to see how well it works. They tolerate it very well. If your patient is anxious whatsoever, you big advice: give them 0.5 milligrams of Xanax, half an hour beforehand. Have them take an Uber back and forth so there's no liability, and they'll do extremely well. Again, very easy. It does not have to be an exact motion. Just make sure it's perpendicular to the skin. You have the RejuveMD, help glide it across. We generally don't have the patients use the Revivogen scalp therapy, which is a formula used on top of the scalp every night before they go to sleep for at least 2 to 3 days. And that's because the carrier of the Revivogen scalp therapy is alcohol may irritate the scalp. So we have them wait 2 to 3 days and use it afterwards. It's not you don't use the microneedling with Rejuve, Clearogen, and Revivogen for increased absorption. Certainly you do get increased absorption within a week or even up to 2 weeks after a microneedling technique. But we use the microneedling to work synergistically to stimulate hair growth, lift and tighten up the skin, and help with fine lines, wrinkles. You doing okay?
Yes.
Actually, again, we're not using it to the depth where it's getting minute amount of bleeding on over here. Nothing too dramatic. And we just don't treat the area exactly where the hair loss is. We go beyond the area because already those areas are being affected by DHT and becoming finer and thinner. We want to help stimulate those areas there. And again, we're doing 20 or 30 passes on the scalp. We can always use it set up for maybe we go right into the hairline also. I go right into where the area hair loss begins to happen. You doing okay?
Yep.
You feeling a little bit or a lot?
That's good. Like pain.
Yeah. And I could.
Very slight pain.
Slight pain. You can see again, he's red. He's bleeding a very little bit, minute amount of bleeding. We're getting into the papillary dermis where the blood vessels are. You want to be able to get that to know you're getting at least into the papillary dermis. You don't need to have frank bleeding or dripping or bleeding, but we're getting into that depth. And then we go into the other areas right there. Willow's peak over here. Again, do not use the Revivogen scalp therapy for 2 to 3 days. After this, they can use a shampoo and conditioner clear. They can shampoo and condition their scalp. Then wait until the next day for them to do that. Okay. Been good?
Yep.
Okay, and this is an abbreviated session. I didn't do the complete treatment just to demonstrate for you guys. Let's see if there's any questions. We're approaching our hour time. Make sure I answer everybody's questions.
Right.
And again, before the patients go home, we put Rejuve all over their skin or their scalp to help as an anti-inflammatory and also help moisturize the scalp and to get the growth factors within the skin.
For hair growth using the microneedling, do you use numbing cream?
So for the scalp, we also use the numbing cream that's tetracaine, bupivacaine, and lidocaine. This instance, we just use 3% lidocaine, but use of all of those three in combination, hour before, half an hour before, for both the face and the scalp, makes it much more comfortable for your patient. And again, you can use an anxiolytic like a Xanax or something beforehand or Valium for the patient, for them to relax a little more while they're having the treatment done.
Okay. They said, have you actually done a study comparing the MicroPen PRP versus MicroPen with Revivogen for hair loss? Bless you.
Thank you.
So there's two doctors that are doing the study for us. I believe in doing more independent study. All our products have had independent studies. We haven't had the results yet to answer how Revivogen independently works. We know how Revivogen independently works because we have a clinical study on that. There are studies showing how microneedling works, but there's not a study completed for use of Revivogen and microneedling, and not completed study for Rejuve and microneedling. We should have that within the next few months. We will make everybody aware of that.
Can microneedling be used with other modalities like laser, Botox, or other systems? And what are the times and separations?
So the question is can you use microneedling with other techniques, Botox, lasers? Generally, you don't want to do fillers or other injectables the same day that you're doing the microneedling because you're going to get some swelling. In case you're going to do Botox, you're going to get diffusion of the Botox into areas where you don't want it to go to. I usually give about a week intervals between different treatments, even if they're having microdermabrasion or facials. I usually generally give about a week interval so there's no worry about any other variables present to cause any particular side effects.
The next question is, what do you use post-treatment, and do you use a mask afterwards?
So what do we use post-treatment? As I said, we use RejuveMD, the serum gel, on the scalp or on the face while we're doing the treatment, and we put a layer of Rejuve after treatment both on the face and the scalp. When they go home, they can, if they're using it for scarring, rejuvenation, anti-aging, lifting and tightening, they continue using the Rejuve at home. They put it on twice a day. They don't put anything on top of it for at least 20 minutes. For the scalp, generally what we have them do as they go home when we apply the Rejuve, For 2 days, just do normal shampoo and conditioning. You can use a Revivogen shampoo and conditioning, and do not use a scalp therapy for 2 days. Now, some patients, if they want to get a more aggressive treatment for anti-aging, sometimes we do the microneedling and I do a chemical peel at the same time. Now, you could do the chemical peel of 15%, 17 to 20% trichloric acetic acid. You could use Jesner's or other modalities. What I prefer to use is TCA along with microneedling if I want to get more aggressive. These are generally patients Fitzpatrick 4 or less, lighter skin individuals. You don't want to do it on darker individuals because you could get pigmentation changes after the treatment.
Okay, how about someone with cystic acne? How would you treat them with Clearogen and the microneedling pen?
So if they have cystic acne, if they have severe inflammatory cystic acne, generally we have them use Clearogen. Are we on still?
Yeah.
We have them use the Clearogen. We bring down their cystic acne. It could take a week, 2 weeks, 3, maybe longer. Sometimes they need to take antibiotics. So some patients may have polycystic ovarian syndrome or metabolic syndrome, add aldactone or spironolactone. We want to bring those cysts down. And the reason is already their skin is very inflamed. You do not want to treat a patient that's super inflamed with the microneedling. So bring down their inflammation, bring down the cysts, just have them have blackheads, whiteheads, open and closed comedones, papules and pustules. Try not to treat cystic acne with microneedling. And Clearogen is very effective in reducing the overall acne. Again, for the cystic, you may need to use antibiotics for a few weeks and then start doing the microneedling technique.
Is it safe to use microneedling over a psoriasis lesion on the scalp, and is it safe to use with psoriasis but no lesions on the face?
So the question is microneedling safe to use with patients who have psoriasis or seborrheic dermatitis? Generally, when they have a lot of inflammation on their scalp with psoriasis or seborrheic dermatitis, we generally don't treat those patients. Again, you want to reduce the inflammation, whether they have cystic acne or they have psoriasis or severe seborrheic dermatitis. If they have very mild seborrheic dermatitis or dandruff, you can use the microneedling and then use the Revivogen, but simply reduce your inflammation, use topical steroids. Sometimes if you have a recalcitrant lesion on the scalp with psoriasis, inject that lesion, bring down the inflammation. Once the inflammation is calmed down, with the shampoos, with the injections or topical steroids, sometimes you even need to use systemic treatments, then you can use the microneedling. But you don't want to have a lot of inflammation while you're using the microneedling technique.
This is a good question. Somebody said that they just attended a webinar where they saw good results with 5 to 8 passes. What's the benefit of doing 20 to 30 passes and using RejuveMD? So
the question is they attended the seminar and they were getting good results 5 to 8 passes. I generally go more, it's from my experience, it's the art of medicine we practice in my office. I have patients who have not had success when they've gone to other places. Either they have gone not very deep, only 0.5 millimeter depth, or they have not had a lot of passes. But once they come to our office, we do a more aggressive treatment, deeper depth, more passes, they get a much better result. I would have to see, if they have done any kind of study with 5 or 8 passes or done any comparison, but we have done small number of passes, but you may need to do more intervals. Again, our intervals are monthly intervals. We do 3 to 6 treatments within a 3 to 6 month period of time.
How effective is microneedling for rosacea, and would you recommend it?
So the question is, how effective is microneedling for rosacea? We don't specifically use microneedling for rosacea. We use it more for acne. A patient could have acne and have rosacea. You want to use the Clearogen sulfur and use the microneedling, and then they're going to get benefits not just for their acne, they're also going to get benefits for their scarring, lifting, tightening, and anti-aging effects in the skin. We don't have a specific treatment protocol for rosacea. We have it more for acne, anti-aging, lifting, tightening, and hair loss. Next question.
That's it. That's all the questions.
Okay, so far that's all the questions. Again, the webinar is going to be available. You can view it, I guess, anytime for a How long is it available online?
Oh, it's available forever, and we'll have a copy that will be emailed to all the webinar participants.
Well, like everything on the internet is available forever. So we're going to email all the participants the address to the webinar. And you can share the webinar with other people. If there's any further questions you have, you can email Jennifer, or I will provide the email address. We'll get back to you with any of your questions. If you have any product questions, you could email Jennifer at jenniferk@Revivogen. And the products are, again, very effective. They are primarily sold within physicians' offices. The physician recommended, the physician sold all over the world. They're scientifically proven. They have a unique delivery system to get the active ingredients within the skin. You will see great effects for your patients, your clients, and if you use these treatments, whether it's Revivogen, Clearogen, well, if you're using lasers, if you're using microneedling, if you're doing injectables, they work very well for your patients. And your patients want to have something to take home, and they're involved into helping their skin. And it's guaranteed to work for them. So if it's not working for them, they could always return it. We have a replacement of the product for you. Okay, thanks everybody for joining us tonight. We'll have more webinars in the future. Have a good night. So how many people is that?